After speaking to a subscriber patient of mine yesterday, I kind of got focused into what I'm supposed to be doing. I think that a lot of people have gone through this COVID crisis, and I hope we're coming out the other end of it. But with everybody having an extra 10 pounds and not being able to move it, well, I think that's the problem with being middle-aged, is that when crap occurs, it's harder to reverse the crap than you were in your 30s and 20s, definitely. Some people are gifted. I have a gal, Jenny, who went through, I think, her third FMD, and she knocked off 15 pounds. And I thought, man, I'm so jealous, but I'm also very proud. My patients and subscribers are doing things that are maintaining or reversing illness, and I know I've spoken of them and I've posted, but I have to go back to what I was doing before to refigure this. My whole intention when I see patients and clients and subscribers now, because of the advent of Zoom, which I can see you if you're from another country. I have a couple patients outside the country, so see my website, Herbal 411, and you'll see how we can do lifestyle change from a distance. Kind of cool. If I can do this with you halfway around the world, we can start to cause little surges of lifestyle change around the world and maybe get past this COVID thing or the next COVID that's coming. So the idea always is to lead a healthy lifestyle, and I try to post what is happening in a minute-to-minute, day-to-day basis in my clinic, and I think it's reflective of the area where I live in Bartlett, Illinois. But I think it's also reflective of a greater scope where everybody's suffering. Whether it's middle-aged, younger, or older, there's a lot of crap that occurs. There just happens to be a concentrated amount of crap now. I guess you can call it diarrhea. So the world is going through COVID diarrhea, and we're getting past that, and we're having to deal with the hemorrhoids now and the dehydration. So if coming out the other side of COVID means, number one, that you're up a couple pounds, all right, it's time to get back on the horse and reassess how to rescue and reverse. If you are out of shape, can't lift anything, can't run, don't have any endurance, that's okay. We'll restart. Just don't hurt yourself. If you are down in the dumps or your anxiety is out of control, that's okay too. But regardless of if your sleep is off, so the four big factors, eating, activities, sleep, and mood, if they're all off, that's okay. We'll bring them back down. But I probably should start with tidying up life. And Martin had a question, how long, and this isn't a minute clinic, but how long do I continue the rescue stuff just in case COVID? So if you watch my videos on zinc and EGCG, this is a huge bottle. I didn't mean to buy this much, but I'm ready for COVID for the next 3 years. EGCG, zinc, and quercetin, I think that the data is great. I mean, we had to scramble at herbal data, and I think it's valid because all the other video vloggers that I see online, as far as doctors, they kind of went away from hydroxychloroquine, they went away from Zithromax and the HIV medicines and they went back to finding what will make the population stronger. And it's healthy lifestyle and taking care of deficiencies and balance. So I hopefully will be able to stop at least these three, although quercetin is pretty decent for allergies, hopefully stop by next week. So I've posted in my other videos, if there is no local surge in Illinois, I think we, through Pritzker, have probably gotten over the hump. And in case there's going to be a survey of different populations within Illinois and probably throughout the United States, if there's a little uptick again, then we'll be able to scramble and put it away and put that fire out and bring it down. So overall, the surge was happening, then we had lockdown, and now hopefully we're getting to the point where we can maintain with a different vantage point and rules. Please, mask, wash hands, all the other stuff. And then hopefully you'll see it over the course of several months decrease, not only in the United States, but across the world. When it gets to that point, I think we'll beat it down into almost like a influenza resurgence every winter. And whatever's happening in the southern hemisphere now is going to be fleeing itself upward to the northern hemisphere in the winter months, in the fall winter. So keep an eye out and watch the trends. If we can't even get past that because too many people are anxious to go to the beach or get into bars, hey, come on. Even if you don't have symptoms, you can still carry. So don't think that you're feeling fine and you exercise or you work 60 hours a week slinging a 5-pound sledgehammer that you're healthy. No, you can still carry and you'll infect everybody. And then you will be symptomatic. So I'm not saying shelter at home for the rest of your life and take all these supplements for the rest of your life. But I'd say you got to be healthy. The stuff that we're doing for COVID is the stuff that I profess to do to beat heart attack, stroke, neurodegenerative diseases, and cancer. So nobody wants to have these diseases. It makes life terrible. If you can get to 100 without any diseases and be independent, oh, so awesome. But that's unheard of in the United States because of our lifestyle, except for Seventh-day Adventists. They're one of the blue zones in the United States. So the idea is, okay, if this is happening, beat it down a little bit so at least it's manageable. And I'm not I can use prescription medicines because I have a license to kill. No, I have a license to prescribe. So I can use prescription medicines to control these things. But if you do nothing to change the cause, then these things will pop up in your 50s, 60s, 70s, and then express itself. So if you can have lifestyle change and keep it down 50, 60, 70, man, I think it'd be such a great thing to take care of your great-great-grandkids and tell stories. Because nobody's teaching cooking, nobody's teaching or telling about old-fashioned stories and handing down tradition. And if we don't have tradition, you have no basis, and you'll have a lot of people that are in turmoil. So it's still old-fashioned, but I think it's valuable. Storytelling, hanging out, eating dinner together, saying the rosary if you're Catholic. So I think all these things are important, but we sometimes rationalize. I rationalize by saying, oh, I'm too busy. But are you too busy to have a problem with a stent? Are you too busy to have insulin twice a day? Are you too busy to take a plethora of 4 or 5 different prescriptions? I mean, I'd much rather take vitamins than take prescriptions. If I have to use prescriptions, I can, like I was saying. But if we can do that beforehand and get to the cause before you see the effect, I think it's very important. So getting to my rant, if Martin's right, I have to go back and watch my patients and see how they're getting successful and utilize that. What I did before might not work for me now. In fact, right now I'm doing a keto blast. I like the information from keto, the ketosis community. I'm trying to use it. I'm a vegan by heart, but I said, you know, I'm getting stuck. I can't move this weight. Let's see if I do keto. I've done keto now. This is the 3rd week. That means meat, bacon, chicken, eggs. So, and if you notice my face, I've never had acne like this since I was in my 20s. This sucks. So this, I think for those of you who eat and aren't a vegetarian, vegan, but God bless you, it's kind of convenient. It's novel. I can go to a restaurant, have calamari and all that other stuff, and they have bacon in the morning, but I don't want to. I just feel lousy. And I think that my formula before, I'm going to try to start it up again. I'm going to get some blood tests to self-experiment this weekend to see if my numbers change. It's only been 3 weeks, probably not. I mean, true ketosis, for me to be metabolically in ketosis, takes sometimes 6 to 8 weeks. I've already been in ketosis just with my fasting practice. I don't eat from 8:30 till 12 noon. Sometimes, especially with Garcinia, I can push that to 1 meal a day, but that didn't work. I don't think keto's working. I honestly think what I was doing before should work, but I have to implement it again. And back to why I started this, Martin reminded me that people are watching. You guys are watching. I really, really appreciate subscribers and comments. I try to get to comments all the time, but when I see other people take off because of what I kind of talked about in the clinic, I sometimes forget the other videos and the other techniques that I've done before. Like when I reviewed ginkgo or cat's claw, it's like, wow, this stuff is really good. NAD, skull cap, this stuff is really good. I forgot. I get too busy. I guess it goes back to, it harkens to this American lifestyle. Too busy to try to get a big paycheck and do what everybody else is doing. That's not what we're supposed to do. It's supposed to slow down. Got to really exercise. Got to move. I had a diabetic patient yesterday that was calling for refills on her diabetes medicine and her pain pill, and I had to get the Q&A going, and she hasn't seen a dietitian. had physical therapy at home, and I appreciate my home therapy folks, but you gotta get physical therapy. Fibromyalgia, 400, 300 pound? A BMI of 40, fibromyalgia, doesn't move. That's and uncontrolled diabetes. What do you expect? And then they're having sugar in the morning, no creamer in the morning, a snack in the morning, and then a couple other things, and a late snack at night. That's not the way to do it. So I don't want to. So I'm not pointing the finger, but I think a lot of patients are just unknowing, and maybe it's because their doctors didn't have time. I blame the medical community because we don't have time. We get like this much reimbursement. I spent like an hour with the lady. She was my last patient. I spent like an hour, and that's unheard of for whatever Medicare will reimburse. $46 or $49.95. That business model sucks. To spend an hour, get $49.95, pay for malpractice, overhead, employee staff, health benefits. Anyway, so my subscriber patients, my clients that are subscribers, my just subscribers regular from around the world, we're all in this together. I think this COVID thing has, in the United States, it's kind of torn us apart and polarized this, but I think the 30,000 foot view is, aside from those people, which will always be, there's always going to be polar people. I think there's also, if you get all that riffraff out, there's also a very strong nucleus of people that are making the change. So I'm really proud of my patients and subscribers. Everybody's asking really good questions. Everybody's got eyes on me, so I have to pick it up. So I've talked about Colorado because I have to answer to myself. And not only will I use Colorado as a summit for me to start making changes to get to my summit for the year. And if you didn't know, my summit for turning 60 in 2 years and 2 months is to hit Everest Base Camp. So it's a big, lofty goal. I don't know if I'll make that. I don't know if I'll make Colorado, but you have to have goals. But now I've adopted a new goal. My new goal is to follow and be accountable to my subscriber base. So thank you very much for subscribing. I'm going to be putting this away. If we make it past any surges this week or next week, because people have been going out in the last 2 weeks and I expect COVID to flare. If it doesn't flare, thank freaking God. But I'm going to put that away until winter time, and I'll probably tidy up the supplements. I'll probably get back to Planet Fitness. I'm tempted to go now because all my equipment at home is boring as hell. I just can't get motivated. And I think that's part of the fibromyalgia kind of sneaking back in, and I'm going to beat that crap down. So we're in it together. Thank you for the inspiration. Thank you for subscribing. Pass this to other people who are finding their way, and we'll come out the other end, hopefully bulletproof by winter's virus, whatever that might be. So in addition, vitamin D has always been a question about whether you continue it for the winter time. I didn't realize my wife bought a lower dose. I was taking 10,000 international units at a time. She bought 5,000, so I guess it was meant to be. I'm going to turn that down. If you are on vitamin D, D3, summertime should be okay, but how many people have the time to spend in the sun? Maybe I'm just coming up with an excuse not to take time and be in the sun, but I don't. Maybe it'll get rid of my acne, but getting off keto will probably get rid of my acne. So if you want to take a break from your pills, I think summertime's fine, but our summer in Chicago is what, 2 more months, and then it's back to cold, cool hiking weather. So take a break. If you're getting tired, you can consolidate your pills, get back into exercise, but keep it bite-sized. I think that what worked for me too before was my bite-sized exercise. I don't know if I reinstill that, if it'll work again, but 15 minutes of hell 3 times a week and then about 60 minutes on the weekend is fine. I just can't seem to motivate myself to do it at home. I'm going to try to get to Planet Fitness next week if the surge doesn't pop up and start kicking some ass again. So those of you on my journey, I'll post on social media getting to the top of 14,000 feet and a couple pictures up there, but if I don't make it, I don't make it, but I'll do it for you guys, and I'll do it for me. So we're all in this together. Thank you for watching. I'll see you in the next video.